Okay, so this is a wall bug progression or a dead bug progression. So Josh is going to start with his hands close to the wall. He's going to push into the wall. That's going to give him some compression. He's going to flatten his low back, so almost like a pelvic tilt, and get as much of his spine down. And now he's going to be taking some nice diaphragmatic breaths, breathing through his stomach, trying to access as much as he can. Once he has this squared away, we're going to start to move his legs. So he's going to alternate picking one foot up and then the other foot. This is the lowest level progression. We're kind of working on diaphragmatic breathing and just getting some hip flexion extension. Next step, once you mastered that, we're going to lift both legs up. Again, making sure that the low back is flat, making sure you're breathing. He can give that compression into the wall, and now he's going to lower one leg down and then bring on up, and then the other leg. Good. And we're working on control. So some patients may only be able to go down, or people may only go down a fraction of that, so halfway, before they start to notice their low back start to come away from the mat. We cannot sacrifice the stability of the low back, so we're going to keep our low back compressed. The next option we have is he can put ankle weights on and make this a little bit more challenging, or he can start to kick his foot out further. So we're going to see him straighten the leg out and then back in. Again, this makes it more difficult. You're going to have to use some abdominal strength here and some motor control. Once he's mastered that progression, he's going to slide away from the wall. In this instance, we'll use a kettlebell. And we have a lot of options. We're going to just show you a few. One option is we can take the kettlebell with both hands overhead, get the legs up. We're going to bring the kettlebell over our head a little bit more. So towards over your head, towards the wall. There you go. And then we're going to do that same alternating legs. Again, he's trying to maintain his low back flat against the floor. And we can change speeds. We can do it slower. He can also give an isometric hold here, so you can lower one leg and hold it for an extended period of time. And we'll start to get tired. Okay, then we'll go ahead and take the kettlebell in one hand. And we can kind of do opposite arm, opposite leg here, so you can split and hold. Again, we have options where you can use some ankle weights, bring it back in. We can do varying holds. But again, the most important thing is to maintain that spine down against the mat flush, as well as maintaining his nice diaphragmatic breathing. Okay, last option we're going to show you is with a barbell. So in this case here, if we need some more weight, we can take that barbell up, again bring it over his head, and we have the option to start to lower his legs one at a time here. And you can change how much weight you have on the barbell, how high over your head you have it, but just a few options in this dying bug, dead bug position.